Mr. Alatory. My name is Paige Alexander, and this is my informative speech through Hutchinson Community College. When babies are born prematurely, they face greater chances of having complications that are short-term and long-term in their life. These tiny humans face great obstacles from the beginning of their life. Hi, my name is Paige Alexander, and tonight I'm going to be doing my informative speech on the health risks of premature babies. Doctors, nurses, and other trained professionals are with these babies from the beginning and right when they're born until they are out of the hospital. Each baby's outcome can be different, even though the treatments are similar. This just reinforces the fact that some babies are simply stronger than others. My sister and I are both premature, so I know firsthand the complications and difficulties that a premature baby can face, as well as their families. According to the book Kangaroo Care by Ludington, Ho, and Boland, a premature baby is a baby that is born before the 37 weeks gestation period, as well as a full-time baby is a baby that is born between 38 weeks and 42 weeks. When a baby is born before the 37 weeks gestation period, their organs have not had the full time to develop, so their organs will be smaller, which allow them to have more complications. For example, I will talk about this later on in my speech, but the lungs are one of the last things to develop in the womb. So when the baby is born early, their lungs have not had the time to mature, so a baby that is born earlier will not be able to breathe as well as a baby who is born later. One complication that a premature baby can face is anemia. Anemia is when the body does not have enough red blood cells that allow oxygen to flow through the body. This can be because their body just simply shuts down the creation of red blood cells, and which will also create more problems with them breathing. Another reason a baby can develop anemia is because premature babies are constantly picked and prodded for blood. Doctors are always doing different tests to see how healthy they are, which in turn makes them lose a lot of blood. Anemia can cause the babies to have lack of energy, gain weight slower, as well as have a reduced immune system, which makes them more susceptible to illnesses. Anemia can be treated in only one way, and that's through a blood transfusion. Doctors will use blood that is packed with red blood cells in hopes of getting as much red blood cells into the body as quick as possible. Another complication that a baby can face is jaundice. Jaundice is the yellowing of the eyes and skin. This occurs from the increased amount of bilirubin in the body. According to kidshealth.com, a website that has everything about childhood, birth, and even premature birth, they describe bilirubin as a compound that comes from the natural decomposition of blood in the body. If the amounts of bilirubin in the body get to extreme levels, the baby can have brain damage. So premature babies must constantly be monitored to ensure that the levels of bilirubin are not too high. Jaundice can be treated in two ways. One of those ways is phototherapy. Phototherapy is the use of ultraviolet lights to reduce the levels of bilirubin in the body. When having this treatment done, these premature babies must wear protective eye goggles because the wavelengths could harm their eyes. In extreme cases, doctors will perform exchange blood transfusions, which is where they take all the old blood in the body full of bilirubin out and put in new blood, so the baby will be able to create a new life system without the amount of bilirubin in their body. My sister had jaundice and was able to not have any problems or brain damage because the doctors caught it early enough. Another thing that babies can face is called RDS, respiratory distress syndrome. This is when their lungs do not have the amount of surfactant they need to breathe properly. Surfactant is a compound that lines the inside of the lungs and allows the baby's lungs to expand. Doctors treat this in one way, and that's by inserting artificial surfactant into the lungs, which allow the babies to breathe better until they are able to produce their own surfactant. Right after birth, babies are kept in the NICU, which is known as the Neonatal Intensive Care Unit, which is made to be more like the womb. Lights are kept low and people speak in quiet voices. Premature babies may be small, but they're fighters. They are able to overcome these great obstacles, which continue on to great lives. My sister and I are perfect examples of this. We were both premature. She was born at 24 and a half weeks gestation, while I was born at 26 and a half weeks gestation. This just shows that premature babies can live on to be healthy, active, and have no health complications past those first few weeks of life. Thank you.